Thank you so much, Dr. Rogers. How is Kisubi Hospital?
Kisubi, we are serving the nation. We are okay. We are smiling. We are happy. We are a happy nation. Our patients are okay. We are saving lives.
That's beautiful, and I'm happy that you love your environment where you're working from, and thank you for serving Ugandans. We all have a responsibility to serve, and I believe the power you hold in serving determines the patient outcome.
True.
How's the patient turn up that side?
Over the years, when you look at our statistics, we've been improving.
You've been improving.
Yeah, numbers can tell.
Numbers can
Yeah.
tell. Excellent.
Yeah.
Thank you so much, Dr. Reja. Let's quickly go to the main discussion topic of tonight. We want to explore and demystify complexities around tuberculosis and how best the nation should learn about tuberculosis. First of all, what's tuberculosis or TB?
Thank you, Mr. Kamara Daniel. Tuberculosis, just like you said, it's a world burden. It's a global burden. Recently, we were celebrating World TB Day or Tuberculosis Day on 24th of March. It is celebrated every year, and Uganda joined other parts of the world to celebrate TB, to commemorate TB Day, and it's actually the second biggest illness, infectious illness that kills people, second with HIV/AIDS. So that alone can tell the burden of TB in this world.
When you say infectious, what does the word infectious mean?
Infectious means just like we had people used to COVID-19, you know, and they were saying distance yourself, what, you know. It is a disease that you can acquire from an infected person close to you. Okay. Yeah, so TB is one of them, because when you look at its transmission, you don't just get it from a room where you just staying alone. Okay, yeah. So it is infectious in a way that you must get it from an infected person. Yeah. So maybe to take you through the mechanism of transmission, the mode of transmission, it's basically through the saliva droplets, okay? Someone coughing, sneezing out, and say, God forbid, say you have TB, and
What
I'm just...
if you are the one who had?
No, I'm not coughing. It's okay.
No, it's okay, please go ahead. This is
so,
just a joke.
yeah,
What
true.
if I have TB?
Yeah, so if you have TB and then you're coughing, probably the air droplets, those saliva droplets, they may be minute for everyone to see, but if I'm not protected or not at a distance, then I'm likely to inhale them. Yes, and they'll go into my lungs, and that's how you usually get TB, what we call pulmonary tuberculosis. Yeah, at a later time, maybe we shall explain. It's not only PTBA or pulmonary tuberculosis, we also have extra pulmonary tuberculosis.
We could explore the other types of tuberculosis for
Yeah, because every time we talk about TB, people always want to think about pulmonary tuberculosis. Yeah, but is pulmonary something to do with the lungs, okay? But we have different illnesses to do with tuberculosis, other types of TBs. We have TB spine, okay? It can be TB of the brain, what we call TB meningitis. Okay, you can have TB of the heart, that is TB pericarditis. You can have a TB of the abdomen, okay? So there are different types of TB. So, but people are used to PTB, the one of pulmonary tuberculosis, yes.
Wow. Thank you so much. Now, and of course, now we'd like now to know what is the most prevalent tuberculosis that you're talking about. And then we can go ahead and explore the risk factors to developing it and a few statistics in case you have some for us.
Yeah, well, these are documented statistics. Just like I said, on 24th of March, we're commemorating this day of tuberculosis worldwide. And maybe to do with statistics, we had around 3 billion of the whole global population having TB. And when you look at the whole world or global population, we are about 8.3. So that tells you the burden of TB. Yes.
300 billion. Was this concentrated in Africa or globally?
That is global.
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 How about here in Uganda?
Here in Uganda, maybe we have statistics. These are documented statistics. It is also documented that approximately 96,000 people, yes, acquire TB every year. Those are new cases.
96,000.
Yes. That is the incidence rate. And then out of these, 32% are infected with HIV. Yes.
32%.
32 are infected with HIV, and 15% of those cases, they are children below 14 years.
Children below 14.
Yes.
Okay. Wow. Thank you so much. Now, let's explore the risk factors. What could be those factors that can risk me? For example, though you've seen me here, I think it's the first time to see me. What could risk me, the way I look like, to get TB?
Well, I don't want to use the way you look like. Yes, but we have general risk factors for this illness. Tuberculosis has risk factors just like any other illness. One of them is overcrowding. People who stay in overcrowded places, let it be people, inmates, those in prisons, those are overcrowded places, schools. If you get one who is infected, it is likely to actually transmit that illness to other people because they are in close proximity always. And people, I know your specialty is nutrition. People who are immune suppressed, malnourished, those are people also, immune suppressed can also include people who are HIV positive, people who have cancers, people who have diabetes, what we call underlying conditions. Their immunity is actually low. So those are people at risk of getting TB. They easily acquire it, okay? And then when you also look at our profession as medics, we are at risk of getting TB. Yes, because someone will come in, have cough, and then is coughing. So if you're not protected enough, you're likely to get TB. So those are major risk factors for TB. Yes.
Major risk factors for TB. Wow. Thank you so much. And most people say relate poverty to TB. Could you be knowing any relationship between poverty and TB?
Yes. Now, something to do with poverty. Look at someone who is, say, has 10 children. Okay, has 10 children. Some are married, some are not married, and they just stay there. They share everything, cups. They stay in that overcrowded place. Trust me, if any one person comes in with an infection, it would be easier for those people to actually take up the burden. It would be easier for them to share that illness. So poverty has a direct connection to do with TB transmission. Yes, so people who have money, trust me, they won't be staying in those overcrowded places.
Wow. So overcrowding can also predispose the population to contracting HIV.
Yeah. Yeah,
So
TB.
what are the main points about TB should people know? You said pulmonary TB is the most common.
Yes.
And we also said that 32% of the people living with TB have HIV.
Yeah.
Why? Why is this like that?
Just like I already mentioned, when you look at HIV, it is an immune suppressing illness. It is an illness that lowers immunity. And just like I said, people who have low immune system, anytime you're exposed to TB, it will actually show symptoms. Okay, we have what we call latent TB. There are people who can contract TB and it does not show. what we call an active infection. But for someone who is immune suppressed, trust me, you're going to get TB and it will show. So we won't stay in that latency. Yes.
Wow, wow, wow. Please highlight more, highlight more. Give us more information about that.
Yeah, because
about latency, what does that mean? And
well, maybe the difference between latency TB, latency tuberculosis, and active tuberculosis. In latency tuberculosis, you're going to acquire the infection. Probably if you go for a test, what we call a tuberculin skin test, it will show that you're TB positive. But you as a person, you want to be having all those symptoms of TB, okay? And then in active infection, in active tuberculosis, we are going to find that you're going to find that a person will come in, say, to Kisubi Hospital, and he'll be presenting with, so I've been having cough for about 2 weeks. I've been having cough for about 3 weeks, and then it is also a role of a doctor to explore. Try for us, we're clerks. It's like we try to police officers, they try to go into, they really want to dig in more, they want to know more,
to probe,
they want to probe. So it is our role as doctors to probe more and ask any associations. Someone who will present with chest pain, it's not only TB that causes chest pain, so it is our role to try to probe more and know what is causing chest pain, or the relationships, other associations. So in active TB, you have cough for more than 2 weeks, and usually this cough is productive. Okay, it's usually associated with even hemoptysis. That is when someone coughs out. At times they will tell you, at times I cough out blood, sputum containing some blood stains. Okay, and that's cough usually for more than 2 weeks. But in HIV patients, it doesn't necessarily need to be cough for 2 weeks. Yes, cough of any duration in HIV patients, we are always tasked to screen them to be sure they don't have tuberculosis. Other people also at the risk of TB, there are those children below 5 years because of their immunity. So usually we screen them as well. But also the other common symptom of TB, people usually present with drenching night sweats, oversweating at night. They will tell you even sweat and change bed sheets. That's not common, right? Yeah, so those we call it drenching night sweats. Another key symptom there in TB, we have a fever. Yes, we have fever. So majorly those are the 3 key symptoms, general symptoms of TB, and that is TB of any part. But to do with PTB, what we call pulmonary tuberculosis, tuberculosis of the lungs, someone may go on to tell you I have chest pain. But there are very many causes of chest pain. It can be a cardiovascular illness, it can be a cardiac issue. But chest pain is one of them. Weight loss, okay, it's one of them. And intentional weight loss, loss of appetite. Other TBs, maybe like TB of the brain, they'll tell you dizziness, headache, okay, that is TB meningitis. TB of the spine, they can tell you back pain, TB of the brain, can be, TB of the abdomen, abdominal pains, yeah. They will present with abdominal disturbances, loose motions, diarrheas, So we always have to explore more, ask, do investigations, and try to come up with a conclusion.
Wow, thank you so much, Dr. Rajan. Of course, For viewers who have just joined us, we are talking about tuberculosis. You should not get worried if you hear of such words of TB, tuberculosis of this part of this side, and the risk factors that are being talked about. Dr. Roger, what could be the exact cause of tuberculosis?
Well, we have what we call a bacteria. TB is a bacterial illness, viewers. It is caused by a bacteria called Mycobacterium tuberculosis. Yeah, that is the commonest. We have other species that can be gotten from other sources, but the one which is commonest is M. tuberculosis or Mycobacterium tuberculosis. Other causes, we have another bacteria species called M. bovis, the one we get from milk. I know you like milk. But unpasteurized milk puts you at the risk of getting tuberculosis. Yes, and have other species, M. africanum, there are many. There are many. So it is caused by bacterium. Yes.
Wow. Wow. Yeah. Thank you so much. And of course, dear viewers, we go for a short quick break. When we return, we shall discuss more about tuberculosis and how best the care in Uganda is and how to prevent yourself from getting the complications that are related to tuberculosis. And of course, exploring you to prevent yourself, because prevention is better than cure. See you shortly.
Good Day TV, transforming your life.
Wayagala ebyuma ebirungi ebyogera basita pasiteri atunda nange ngoma nekita zonna basita pasiteri amplifier n'emizindalo basita pasiteri ebitala bya siteji ebyebika byonna basita pasiteri ebyuma bya iveti tubirina byonna basita pasiteri awundo wa screen tupangisa basita pasiteri kukizimbe kya Newmark William Street basita pasiteri kati ndogendayo musajja mwesigwa kituufu endo gye gisoboka ekibanja mpola akikwata wagula ebyekkanisa jangu ewa pasita pasiteri
tusangibwa ku kizimbe kya Newmark ku William Street ku ground floor room number N31 opposite DFCU Bank. Esimu noti 78200 ne noti 75200 wano wokka we tusangibwa.
Don't miss on Google TV.
From Woman Blossom annual getaways, the summits, the planning and prayer retreats, we bring to you an amazing Woman Blossom TV show. In a world where women are demanded so much, it is time we paused, healed, and blossomed. Join me, Giftina Kayinga, every Sunday, 5 p.m. live on Google Day TV as I bring to you an amazing Woman Blossom TV show.
Don't miss on Google TV.
Life is a race, not against others, but for a purpose greater than yourself. Every step you take matters. Every decision you make can change the course of someone else's journey. At Makere Full Gospel Church, we are running a race too. A race to purchase land next to the church compound so as to expand our parking space and build more infrastructure for God's work. With your purchase of Run Your Race book, authored by our very own Pastor Fred Wantanti, for just 30,000 Ugandan shillings, you're not just buying a book, you're joining the race. All proceeds from the book sale will go toward purchasing the land. Together, we can build a legacy that will last for generations. Buy your copy today and let's run the race together.
Good Day TV, transforming your life.
Once again, I want to welcome you from our short quick break. I am Kamara Dan, your presenter for this Health and Beauty program. Just like before we left, we had earlier promised that when you come, we'll talk about the investigations or what's done to fully give out the diagnosis of a TB, but also to look at other diagnoses that could show to be like TB when they are not TB, or what we call differential diagnoses. And I'm still being joined by Dr. Rogers from Kisubi Hospital. Where is Kisubi Hospital located before you go to the differential diagnoses?
Thank you once again. Thank you for hosting me once again. Kiso Hospital is here in Wakiso, not far from Kampala, on Entebbe Road. Yes, it is located in Kauku. It is near, it's just a few kilometers from Kampala. So it shouldn't be an excuse that you can't come to have a TB screening. It's just near. Once you've reached Kauku, you will obviously see a signpost on your left. And even if you ask anyone, so hospital is just around Kisubi Hill.
Wow.
Yeah.
Thank you so much. Now let's define better the other differentials you talked about, the other diagnoses that could masquerade to be tuberculosis when it is not TB.
Thank you, sir. Differential diagnosis is an illness that may look like TB, okay? It's an illness that may look like this that we're talking about. So when you look at differential diagnosis of tuberculosis, these are diseases that may show the same symptoms, say shortness of breath. Someone presenting to a clinic with shortness of breath, we are going to look at diseases that can show that can make a person present with shortness of breath, chest pain, fevers. So it can be a pneumonia causing someone to have difficulty in breathing or shortness of breath. It can be COVID-19. Okay, it can be HIV causing someone to lose weight, to have drenching night sweats and fevers. It could be a cancer, commonly lymphomas. Those are the cancers, and some other blood cancers. Okay, they can make someone present with same symptoms like someone who has tuberculosis. And in a special way, we have very many diseases of the heart. And as Kisubi Hospital, we are known for that. It is actually known as a heart center in this region. Yes. So patients usually present with chest pain. People with TB. And chest pain is also another key symptom of heart diseases. So, excuse me, so you can have a patient presenting with chest pain when actually they have heart diseases, coronary artery diseases, heart failure. So they may be having heart diseases when actually you may think it is TB. And it can also be a complication. You may be having complications of TB causing you, or you're suspecting that it is TB. Then what do we do to confirm that it is TB?
Tell us what you do.
Yeah, probably. Those are what we call.
Tell us what you do.
Yeah, probably. Those are what we call investigations or tests. Okay, a number of tests are in place. Commonly, we have what we call gene expert. That is the standard one and the recommended investigation to confirm the bacteria. We can also do culturing of the sputum, culturing of the part that you want to be sure that it has no TB or there's TB. Okay. There's also another investigation called biopsy. Usually that is done say, in a tissue, you picked a tissue, you want to be sure that you don't have TB, you pick a tissue. Commonly you want to, that is usually, the commonest is actually when we see someone having, say, lymph nodes, swollen lymph nodes, those are lymphadenopathies. You're not sure whether they are swelling because of some other illness or it is TB. Okay, it can also be a cancer. So you pick a lymph node from, say, around the neck where they are palpable, and you take it to the laboratory biopsying, okay, and confirm whether you have TB of the lymph nodes or not. Another common investigation done, we have what we call imaging. Yes, imaging includes ultrasound scan. Okay, that's if you're suspecting. It can help to tell whether you have TB of the abdomen. Yes, and can also do imaging to do with chest X-rays. Yes, that's commonly done as well. It can show what we call consolidations, cavitations, to show that we have TB in our lungs. Another imaging modality, we have CT scans. Yes, we do CT scans, say at Chisubi Hospital. You can do a CT scan of the chest with a lung window, and it helps to tell whether they have TB. And in a special also, we have MRI. That's not common. Yes, that's not common. But at Kisubi we have an MRI. In fact, we have an AI-powered MRI. Yes, that is the second latest in Africa. Yes, you can Google about that. It is the second in Africa. The first is in South Africa, and it is at Kisubi as the second MRI, AI-powered. So all those imaging modalities can help to tell whether someone has tuberculosis. Yes.
Wow, thank you so much for exploring that part where tuberculosis can be better diagnosed. But before we go to the treatment, prevention, and the complications, in your own perspective as Dr. Tukwasibwe, how best can we end TB in Uganda?
Thank you, Dr. Kamara. This year's theme was, yes, we can end TB. And indeed, just like we said, we can end TB.
But how?
Yes, we can. Because when you look at risks, when you look at the risks that put us to contracting TB, and we try to revise them with the support of the government, but it also starts with us. Okay, we are the government. I, as an individual, have a role to play, and you have a role to play. We have to do screening. We have to avoid overcrowding. We have to encourage people to participate in government programs of immunizing newborns, okay, against TB. That's usually done at birth, okay. We have also to help. There are people who also have a negative perspective towards those immunization, those vaccines. So, but we have a role to play. We can end TB if we try to look at the risk factors and we try to revise, avoid crowding. Say in my clinical room at Kisubi, it is well aerated, okay? And you put on a mask if you suspect, but also you have to distance yourself from a patient who is looking like maybe they have TB. Okay, actually, you must take every patient as an infectious patient. Okay, so if you try to do that, then we can end TB.
Wow. Yeah. Thank you so much, Dr. Rogers, for your expert opinion. Now, we want to explore the treatment options so that now if treatment fails, we rush the complications and explore prevention, and then we can plan to live.
Thank you. First of all, it all starts with you. Say you've been diagnosed with TB, you must adhere to treatment. Trust me, if you do what the doctors tell you, we can end that TB. We can treat that TB and it heals. So there's nothing like it is going to complicate. Yes, it does if you're not good at adhering what they are telling you. You're not respecting what they are telling you. Treatment, there are drug combinations, okay? We have what we call drug observed therapy. That's DOT. You're given treatment, and at least with the help of a caretaker, then they make sure that you're taking those medicines. They make sure that they remind you that you have to take TB. We have they are in 2 phases, what we call initial phase and then the continuation phase. Commonly, you start the initial phase combination regimen for 2 months. Yes, and after 2 months, we give you treatment for the next 4 months, and then we keep checking. We keep checking because of late we have a burden of resistance, and that's one of the medicines called rifampicin. We get what we call rifampicin resistance. So we keep checking to be sure that you don't have that resistance, and if you have worries, have other options. Okay, there are other second lines because the other one is the first line, and then we have other drug regimens for children for 2 months, and then you again do the continuation for 2 months. We also have another regimen for 2 months in adults, and then for 2 months again. But those are medicines. They are available. They are antibiotics, just like I told you. Mycobacterium is a bacteria. So you take treatment, and if it fails, we always have the second line. But if you're good at swallowing your medicines, TB heals.
TB heals.
TB heals.
Completely.
Completely.
Okay. Now, thank you so much, Dr. Rogers Twasiwe. Now, let's explore a few complications that are really common that we would want our viewers to learn more about related to tuberculosis.
Yes. Complications of tuberculosis. You've heard of perfusion. You can have...
Let's explore that one by one.
One by one. Yes, thank you. Perfusion is when you have fluid accumulating in your lungs. Yes. And it can cause more complications of difficulty in breathing, shortness of breath, because your lungs can no longer expand because there's some fluid, water, something like water. Okay? So perfusion is one of the complications of untreated tuberculosis. It can actually also cause you, because just like we said, tuberculosis can start maybe from the lungs, but it can spread to any other place. You can have TB of the lungs spreading to the brain, and you get issues to do with brain encephalopathy, seizures, okay? You can have respiratory failure because probably it can also worsen to death, okay? All those are complications. But also, commonly, when you look at the anatomy, the positioning of the lungs, they are next to the heart. Yes, so we usually have a direct transmission of the bacteria from the lungs
To the heart.
to the heart, and basically to the pericardium. The pericardium is a sac. It is a sac of the heart. The heart it's actually in a sac, and that is what we call a pericardium. So a major complication is pericardium, TB pericarditis. Yes, TB pericarditis causes a person to get what we call also something like perfusion. Fluid can accumulate in the pericardial sac, and that means your heart can no longer expand normally to pump blood. Okay, and you end up with heart failure. Okay, yeah, you end up with heart diseases. Actually, because Kisubi is a heart center, I was trying to read about some research is being conducted. 60% of patients with TB have heart diseases, have what we call cardiovascular diseases. Yes, these are patients who have coronary artery diseases, pericarditis, atherosclerosis. So, I mean, we have a role to play. It's not about treating, it's also about screening for likely complications. Yes. Maybe lastly, another complication is miliary TB. Just like I've said, TB can go anywhere. So you can have bacteria spreading through blood to anywhere, anybody, anywhere in the body. Yes.
Anywhere in the body.
Anywhere in the body.
I was about now to think of other parts that are anywhere.
Yes, anyway you can have TB.
Okay, thank you so much, Dr. Roger. For our dear viewers, thank you for being good viewers and for learning with us about tuberculosis. And the major point of this emphasis is how can we end this infectious disease across Uganda, and what are you doing, what am I doing, and what can the government do so that we can manage this as a team. Now, of course, we want to explore. The last part of this is prevention. Prevention, Dr. Roger, remains very important when it comes to countries of low socioeconomic status, including where we are seated right now. So give us a few prevention strategies, like 6 of them. Then later we shall end by rallying the political people, our MPs, our government, those people on the table. You know, when you sit down and make a decision, you are the most important person. Then later rally the public, because the public waiting for the road takes time, but also when the community, we can do something.
Thank you. Prevention of TB, you and I have a role to play.
Yes, I do.
Yes, prevention of TB, we shall have to start with adhering to government programs, making sure that all children born are immunized at birth against tuberculosis. That is getting a BCG vaccine. It's a major preventive thing we can do. Okay. Another preventive measure we can also observe is screening. Screening everyone who is at risk of getting TB. Screening all HIV patients for TB, because the earlier you detect, the more, the better the outcomes, okay? And the better you control its spread in the community, to the family members, where that person comes from. So early screening helps. Also in control of TB, we have to screen and prevent all those risks that can put someone at risk of getting TB. Malnutrition, making sure that people eat balanced diet. There, that's your role, sir. Yes, malnutrition, ensuring that you continue telling people to eat a balanced diet.
I can even begin with you. Have you eaten a balanced diet today?
I think I look like I've eaten.
I didn't say you don't look. I asked that.
Yes, yes. Well, I came in and you did your part. Thank you. So we have to make sure that people eat a balanced diet. We have to observe safe sexual practices to avoid HIV. Yes, because we've seen that it is one of the major risk factors of getting TB. Another preventive measure is making sure that we try to avoid overcrowding. Yes, let it be in schools, in prisons, maybe that's to the government. Making sure that we avoid overcrowded places, and where possible, do like we used to do in during COVID-19, making sure that we put on masks. Yes, all those have a role to play with prevention of TB, and maybe lastly, government involvement. Yes, to create awareness. Yes, because some people don't know about TB. Yes, not everyone knows TB, and the community needs to know how they can prevent. Everyone needs to participate.
Just like we are doing it here.
Yeah, thank you.
Thank you so much, Dr. Roger. Now, let's call upon the, let's begin with the public, the community people who are watching us here live on Google Data Vision. What should they start from now to end that TB in Uganda? What should they start immediately? As you leave the studio, what should the community start doing to end TB?
Thank you once again. To end TB, you and I have a role to play. I once again have to say that. If you immunize your newborn, trust me, we shall be minimizing all chances of contracting TB to the community. Okay? Participating in all measures which really teach us about prevention of TB, participating in community health talks, health workers sensitizing people wherever they get a chance to tell them about the burden of TB, to remind them about the complications of TB, early detection, screening, good diet, all those will help us to prevent and control tuberculosis.
Indeed, very true. It will, and it will. Thank you so much, Dr. Rogers. Now, we want now to call upon the government. The government. What should it do to support now the communities that you've rolled out for to reduce the burden? Or we end it completely, if it is possible.
Well, to the government, I think it's all about commitment. Yes, committing itself to supporting TB preventive measures, supporting health workers to go to communities and sensitize people. Okay? Yes, creating rallies, using all social media platforms and create awareness. I appreciate the fact that BCG vaccination is free. Yes, it's a credit to the government. That's a major way of ending tuberculosis. That's a major way of ending tuberculosis. So the government has to keep supporting us, and we keep sensitizing the community, and trust me, tuberculosis will be history. Yeah.
Wow. Wow. Thank you so much, Dr. Rogers. And of course, now I would like to once again say that prevention starts with you, and every person has a role to play. Dr. Roger, could you be having the last remarks around tuberculosis and your last message to the person who has been watching us since this program started around tuberculosis?
Well, tuberculosis, it is something that it is a global burden. Yes, it is a global burden, and we can end tuberculosis.
Yes, please.
We can end tuberculosis. That's if we put into practice what we've discussed here, getting to know that it is a preventive illness that we can end, and eye screening, adhering to treatment, treating complications, and then to everyone who hasn't contracted TB, observing the preventive measures. Maybe also lastly to our viewers, just like I've said earlier, something to do with chest pain, something to do with difficulty in breathing, shortness of breath, all those were the symptoms of tuberculosis. But we also find them as the major symptoms of heart diseases, I am representing a big team of heart center specialists, okay, at Kisubi. We have cardiologists, we have pediatric cardiologists and adult cardiologists. We have people trained in heart illness management. If you've heard of percutaneous interventions, yes, PCI, people no longer go to India. Please, if you get a issue to do with chest pain, shortness of breath, it may not be TB alone. Please, come to Kisubi, don't go abroad. No, don't go abroad, we can manage them. Yeah, we even have a heart camp that is yet to begin from 13th to 17th March this year. It is for both adults and children at a subsidized fee of 150. So come and be screened for heart diseases, and we shall live a good life. Thank you.
Thank you so much, Dr. Roger. Now, Dr. Roger has been coming from Kisubi Hospital, and they're running the population to prevent heart diseases. And this could be one of your way. They are giving back to the community, so prevention is very, very important. And we have also learned the relationship between tuberculosis and the heart diseases. But very important for us to note in general is that prevention is really key, and 75% of the disease prevalence in the country is preventable. And all this begins with you and myself, and how best to support our communities to remain productive, but also live a brilliant life. I am Kamara Daniel, implore you to always watch Google Data Vision on our social media platforms, LinkedIn, Facebook, YouTube, Twitter, so that you do not miss any series of events, including the Christianity and the lifestyle. Please, see you every Wednesday, 8 to 9 p.m. See you.
Good Day TV, transforming your life.
We don't know, or we forget that actually it's our sin that brought Jesus and took him to the cross. He came for that one purpose, to die for us. And the best scripture for us to read is in Isaiah chapter 53. You know, when you read Isaiah, it shows you that, you know what, for our transgression, for our sake, he was beaten, he was crucified, he paid the price. He paid the ultimate price for us. We remember in the Bible that the wages of sin is what? Death.